the Real Health Podcast, brought to you by Riordan Clinic. Our mission is to bring you the latest information and top experts in functional and integrative medicine to help you make informed decisions on your path to real health.
Well, hello, everyone. I'm Dr. Ron Hunninghake. This is the Real Health Podcast, and it's my pleasure today to introduce Dr. Drew Rose. He's our new doctor here at the Riordan Clinic.
Hello, thank you.
Dr. Drew, is that okay if we
Dr. Drew's perfect, yes.
Okay. You're a Wichita guy, right?
I'm born and raised Wichita, yes.
Okay. Well, since I know that we went through a whole process, but I thought it might be good to kind of share with the audience how did we come in contact with you? Because we're very thrilled, and I'll get into that in more detail. But how did you first hear about us?
So my dad actually interviewed several years ago, I want to say about 5-6 years ago, for a marketing position. It wasn't really a good fit. It wasn't really his background either. But that's how my name kind of came up, I guess, in the interview at one point in time. I was in residency, and it was something that stuck with the recruiter at the time, Vicky, and that I'm an osteopath, and that I did a fellowship in medical school that really focused on the principles of osteopathy, and it seemed to be in line with what Riordan was looking for at the time.
Tell the audience, what are those principles? This is fascinating.
Osteopathy, just a little background, founded by a Kansas guy, Dr. A.T. Still, and he actually thought there was a better way, at least, trying to really look at the human body and the self-regulation capabilities, and came up with the 4 tenets of osteopathy, where the person is a unit of body, mind, and spirit.
Wow.
The body is capable of self-regulation and self-healing, and that structure and function are interrelated. And then the 4th tenet is kind of just there as a appropriate treatment is based off the above tenets.
Yeah.
So that's really what osteopathy, the core is.
He and Dr. Riordan could have been drinking buddies.
Oh, absolutely.
They were. That's right in line with the way Dr. Riordan felt in terms of this. It was called the Center for the Improvement of Human Functioning when he first started. Yeah. So, well, what drew you, Drew, into that? What was there? Was there a life experience, or how did that go?
Yeah, there was times when I was younger, I had some health issues. I had Epstein-Barr virus, to a point where I actually missed half of 7th grade.
Wow. Went
through some testing and just kind of felt like you're on a merry-go-round of doctor visits, and I was out of school, so I wasn't around my friends and all these different things. And it kind of got me exposed to being the patient, especially early in life, and not really understanding. Later in life, I was definitely drawn to sciences. I think that's just kind of natural, especially from my family and my background, and was always asking the question, why? In college, I didn't really know where I wanted to go. The average undergrad changes their degree 5 times, I think was average, at least when I was in college, Wichita State, by the way. And I decided to look into medicine, and one way I did that was I became a phlebotomist.
Our son, John, who's a doctor now, he was a phlebotomist. That's interesting. That's kind of an entry route, so to speak.
It's definitely a place to start, at least, and it got me exposed to a different aspect of medicine, not being the patient, at least being on the side of patient care. And being a phlebotomist, you know what test you're going to draw, and you don't really know why the patients are there. You don't really know why they're drawing this test on this patient as opposed to the same test on another patient. So I was always left wondering why. And that's kind of the curiosity is where it kind of drove me into pursuing a career in medicine. Yeah,
Dr. Riordan was big on the fact that when we see our patients, he looked at it as a type of detective work. That's that why thing is, why is the patient chronically ill? Or why are they depressed? Not just, okay, here's your antidepressant or here's your speed medicine to try to help you feel better. That's just treating the symptoms. But if you go deeper and look for the root causes, very often you not only help you not only help with the symptoms, but you actually are able to create a better, more healthy person in general.
Exactly.
So, yeah. So here's another part that when we were interviewing, we were really interested in that after you finished your medical school training, you did a residency in Chicago.
I did.
And
yes.
was that pretty intensive?
It was global medicine on a daily basis.
Yeah.
So I went to Swedish Covenant Hospital. At the time, it was the largest standalone community hospital in northern Chicago proper. It has since been bought out by North Shore, so it has been absorbed by a larger system, but I think that gave it a lot more resources. The community around Swedish Covenant, there was a large Korean population, a large Nigerian population, but overall the hospital boasted, and we would track this on an annual basis, they would have to speak up to 64 different languages in a year. So we would see everything under the sun. And it was, when I say it was global medicine, it was global medicine daily.
And is that how you got to going to Africa? Did it tie into that, or?
So that actually was Rocky Vista. Rocky Vista is where I went to medical school in Denver, a suburb of Denver. It's a college of osteopathic medicine. And it had a honors course called the Global Track. And that essentially just required that I had 3 months of rotations between my 3rd and 4th year that were international. And I was fortunate enough to go to Kenya twice in my 3rd year and my 5th year because I did a fellowship, so I added a year. That was separate from the global track, but I was able to go to Kenya twice then and then twice since medical school, so 4 times total.
What did you get from that?
A perspective.
Okay.
I think perspective is the biggest thing because we were working with the Maasai tribes and just impoverished areas of rural Kajiado County, which is south central Kenya. For those who don't know, that is at the base of Kilimanjaro. So you were seeing the most iconic scenery out there. And it's sandwiched in between Amboseli National Park, which is known for the elephants. Maasai are still living there in traditional bomas. And then on the other eastern side is Tsavo West, I believe, which Tsavo is massive. That is another nature preserve. But that's important because the people living out there are living harmoniously with wildlife. And you see a lot of different things out there that you wouldn't otherwise see in the Western world. So the perspective of understanding how the rest of the world lives is very interesting because it is very dynamically different from what we see on a day-to-day basis here.
Yeah. But I also get that you had within you a willingness to serve.
Oh,
and,
absolutely.
And Dr. Riordan was big on that. He basically said, in the medical profession, sometimes that gets lost in the whole rigmarole of medicine, but that basically we are servants to our patients. Some doctors, I think it's the other way around, but but it's nice to know when you know you're here to help other people get well, and so evidently there was a big part of that in these
definitely
travels.
I think that is something that it didn't just come from Africa. I think that's where I was able to implement a lot of my own servitude of what I wanted to do with my life. I became a doctor because of my pursuit of knowledge, and some part of that, I realized that I loved helping people, and I loved helping people find their own health. A.T. Still, who is one of my role models, when it comes to healthcare and being a medical professional, he had a famous quote, and I might butcher it a little bit, but it was, the purpose of a physician is to find the health of the patient.
Find the health.
Anyone can find disease. And it is this is where I'm going to borrow some words from Riordan, because it is a co-learning opportunity for the patient and the physician to find the health of the patient, because it's not necessarily just here's a disease, here's the cure, goodbye. It is a lifelong process for most of these people. And for people in rural Kajiado County, they don't have the resources that we have here. So you got to find the ways that could really resonate with them, lifestyle modifications or how to prepare foods or how to clean water is actually very, very important. So.
Yeah. No, Riordan Clinic is all about finding the health with each patient. But I'll tell you one thing, in my coming, I had done 10 years of family medicine in Salina, Kansas. And lo and behold, you were in Salina, Kansas, and you did 6 years.
6 years.
Hospitalist.
Yes.
So there is where you find the disease.
Oh, yes.
Which actually, to be a good doctor, you have to know both sides of the coin. So how was that? What did that experience? I know it's a very rigorous experience to be a hospitalist. How has that informed your search for where you want to go next?
So I feel like everyone in the world was affected by the pandemic. But for context here, I graduated residency in 2019, started my job as a hospitalist in Salina, Kansas. It was September 5th was my first shift. So I was out for 6 months, or I was practicing for about 6 months before the whole world shut down. And just due to my background, my residency being boarded in internal medicine and having credentials for ventilators and certain basic procedures, I was the next guy up for intensive care. And I ended up becoming the ICU relief guy, because in Salina, Kansas, they only had one critical care boarded doc. And I did ICU for most of COVID. And that affected the way I saw everything, because no one really knew what they were doing with the pandemic at the time. Looking back, it kind of seems silly, but at the same time, being in it at that point in time with everyone else, we were doing the best that we could. But it really dawned on me that we can't do cookie cutter medicine for every patient. You know, one patient comes in with COVID, how come their ICU status, how come they're requiring a ventilator, whereas you have somebody with the exact same age, comorbidities, you know, general upbringing and lifestyle, and they're doing just fine. It didn't make any sense. And a lot more research has come from, you know, that time of COVID, that there's a lot more that we're missing in just general Western medicine. And I recognized that. I was following a lot of the studies, and it just told me, you know, go back to my roots, go back to the osteopathic principles and practices, and get to know the patient more.
Yeah, Riordan's take on that was the concept of biochemical individuality, that you could have 10 people with the same diagnosis, but they have different nationalities, they have different diets, they have different absorption rates of certain nutrients, or maybe they have toxicities that are unknown that are influencing how the body is using or not using nutrients appropriately. So here at the Riordan Clinic, this is an opportunity for people to come and explore that biochemical dimension, which is more than just biochemical. It's also has to do with how well you're sleeping and what's going on in your family life, you know, your stressors. Those kinds of things. So does that, I mean, obviously you were thrown into the pit of the pandemic, and you had to do what you had to do, but is that part of what drew you here to look at these underlying factors that influence the chronic illness of a patient?
Oh, absolutely.
Yeah.
Seeing patients with chronic illness and coming to the hospital multiple times, sometimes within a month or less even, you know, the frequent flyers that we see, it's frustrating, because you only have so many tools in your tool belt that you could utilize in that setting, but you never really get to the root cause. And you're never really allowed enough time to sit down with the patient and get to know who they are, what their life looks like on a day-to-day basis, and see if there's any alterations in there that could overall have a huge effect in a positive way on them. It's a lot of what I term algorithmic medicine, which I understand the healthcare system and how it's set up, and I understand everyone has a role. But what gets lost in there is, like you said, the individuality of the patient, which is life-changing for them if you could get down to the root cause. So I've always been in the impression that I would do this job for so long and kind of get ahead of my own life a little bit, you know, unwind from residency and medical school, because that was a journey in and of itself. But ultimately, I wanted to be in a position for the rest of my career where I could search for the health of the patient as opposed to the disease, you know, really focus on wellness and quality of life.
Yeah. And another very powerful concept of Dr. Riordan, at least in my experience, is this idea that the doctor-patient relationship changes in that you become co-learners here at Riordan Clinic. And you say, what does that mean to be a co-learner? And a lot of it is learning about the uniqueness of the individual. It kind of comes back to this same question we were talking about, is learning about the patient, before you jump in and say, well, do this or do that, it becomes a kind of working together to find out the root causes and what to do next.
Yep, definitely. And I don't feel like I got that in the acute care setting necessarily.
Well, you were taking care of a seriously ill patient, and you have to, by nature, they're a bit on the passive side. But here we ask people to be more involved in their own health care.
And that is wonderful, because you could only do so much, even in a primary care setting. You may only see the doctor for 15 minutes or so, but the rest of it is up to the patient. But how much instruction do they have? What are their first steps about going out of, into the real world after you leave the clinic? You feel empowered, you've got this, but what do you do now? Yeah. And I feel like that's where a lot of it's left flat. And you need the time to be able to spend with the patients to educate them and really create a solid plan and then have that appropriate follow-up. And I think that is it still is missing in the common, primary care practices, hospitals, what have you. And the Riordan Clinic provides that opportunity to really get to know the patients, let the patients get empowered and, take the lead in their own health.
Well, osteopathy, doesn't that have somewhat of a co-learner thing? I mean, obviously you're the doctor and you're evaluating them, but how does the evaluation and how does the treatment plan involve the patient in osteopathy?
So in osteopathy, it is viewed identically to what is practiced here at Riordan. The fact that the patient is a unit of body, mind, and spirit, however you want to define spirit, you have to recognize that there's all those components to the patient. And the patient knows their life better than we do. And a lot of times, traditionally, doctors only focus on the body. And, there might be therapists, there might be mental health professionals, but it's kind of separate from the primary care aspect of things. When you get down to the root of osteopathy, you want to look at all of those dimensions of the patient so that all of them are cared for appropriately. And it really depends on the engagement of the patient to kind of take the lead of their own health and really engage in the changes that the doctor is suggesting.
So you're helping the patient not only to make adjustments in their body, physical body, but in their lifestyle, in their diet, in their stress management.
Oh, absolutely.
The importance of sleep, relationships, so many things come out of dysfunctional relationships. And so it was interesting to me when I first started here, Riordan was a psychiatrist. Now, I'm not a psychiatrist, I'm a family physician, but I did go through a program where it was emphasized that as a doctor, you need to know a little bit more about the family dynamic and what's going on in the patient's life. They're not just a body, like you say, walking in. They're a whole person, and they've got relationships, and dysfunctional relationships can add into chronic illness just as much as anything else. And so not that we're psychiatry per se, but bringing in all elements in a holistic way to, in order to discover the root causes of what's going on with them.
Exactly. You cannot just treat one aspect of someone's life and expect the rest of it to get better.
Yeah. No, we're really excited that you're here. And I'm just thinking, what does the future look like for you? What are you hoping to gain out of this personally? Come on, this is a big step for you.
Personally, Wichita is home. Coming home is actually very important for me. When I left Wichita, I didn't actually ever think I'd be living here again. And in the 14 years I've been gone, Wichita has changed a ton.
Yeah.
I went from all the way through public schools here in Wichita, USD 259, graduated from Wichita State. Wichita State alone is completely different now. There's dorms, there's, new buildings, the whole makeup is
dynamic.
Is awesome. So personally, I want to engage in the community more and kind of see what my hometown, what they've grown into.
Yeah.
Spending more time with my own family is actually very, very important to me. Residency in medical school does not provide a lot of time. There's a lot of birthdays that I was not able to attend. And being closer to my parents who, natural progression of life, they're aging, I want to be a part of their life. And then professionally, I want to be that doctor people can depend on. I have internal medicine by background, but my core values, my beliefs here is there's room for the integration of, the alternatives and supplements and lifestyle changes. And when you've got a chronic disease and it needs to be managed by pharmaceuticals, let's talk about it and see what we can do to optimize your own health with it.
Right. Yeah, we're not against pharmaceuticals.
Absolutely not. There's room for both.
Yeah. Hey, what about working with the naturopaths? We have 3 wonderful naturopaths on staff here, and isn't that exciting?
I'm very excited to learn from them.
Man.
I'm ecstatic about some of the stuff that they're doing and the research that has come out of the EU. I always point towards mistletoe therapy. I find fascinating because through my travels, I've actually heard about mistletoe therapy, but I haven't known anybody here in the United States that actually utilize it. I'm just as excited to learn from them than I think that they are to learn from me too.
Yeah. Yeah. No, I think it's going to make a really good team. You know, we have nurses here that are open and interested in learning. Everyone's here are co-learners. I mean, in the true sense of the word, and our willingness to look for the deeper cause and to put the patient in a position to where they grow with us. We grow with them, and to see that discovery of better health. That's the way things are. So I can just speak for everyone on the staff here. We're delighted to have you on board. We're looking forward to learning from you. I don't know that much about osteopathic. I know I have a daughter that's a chiropractor, so I know that manipulation is part of what you do as well.
Oh, it is, yes.
And that can be a very important part of structure and function as well.
It can be. In fact, I alluded to earlier, I did a fellowship at Rocky Vista. It added an extra year to my education. It was essentially over all of osteopathic principles and practices, or OPP for short. But the osteopathic manipulative medicine or treatments, also OMT or OMM, because doctors speak in acronyms.
Sure.
But we actually ran our own clinic. We as the fellows ran our own clinic where we practiced this. And you could really make some big impacts and changes in people when you have them in your hands and you're manipulating the different tissues and viscera.
Yeah.
So chiropractic did spin off of osteopathy in the late 1800s, early 1900s.
Wow. So osteopathy came first.
Yes. So the first chiropractor was actually one of Dr. A.T. Still's first students.
Wow.
Yes.
Didn't know that.
Mm-hmm.
Well, anyway, we're thrilled to have you here, and I hope the audience is knowing that we have a nice young man here that is ready to go.
I'm ready.
And so join us, and thank you, Dr. Drew. We're pleased to have you aboard.
Yeah, absolutely. Thank you, guys.
Thank you for listening to the Real Health Podcast. If you enjoyed this episode, be sure to subscribe and leave us a review. You can also find all of the episodes and show notes over at realhealthpodcast.org. Also, be sure to visit riordanclinic.org, where you will find hundreds of videos and articles to help you create your own version of real health.